What's really different about CMIPS is that we focus on the methodologic development rather than exclusively the practice of implementation research. Nobody else is doing this, not in the context of a center with a group of people all focused on that goal. So we're using mathematics, computing, statistics, probability theory, and so on to facilitate the conduct of implementation science research. We create new methods for health economics and evaluating the cost effectiveness of new interventions and projecting their cost into the future under different scenarios.
In addition, our centers is branching out in different directions. For example, we are leading the frontiers of methods for cluster randomized trials, stepped wedge designs, which are now almost the default in evaluating healthcare interventions in complex healthcare systems under the routine care conditions. In addition, the recent flexible learn-as-you-go design also allows us to identify the most cost-effective strategies and combinations of the intervention packages as the study moves on.
This field of implementation science is taking off at universities and research institutes around the country. And what the spaces that we wanted to fill is really recognizing that there are certain public health problems that can be solved with new ideas, but we need methods to analyze the data that are coming out of our projects. The Center for Methods and Implementation Prevention Science is specifically focused on developing new methods in quantitative areas, in qualitative areas, and in health policy to accelerate that process. How do we actually build knowledge and replicate that again and again? So methods that can help us analyze data and solve these problems and learn over time.
The program stands apart because we are actually emphasizing innovative and interdisciplinary methods and collaborations. We include experts in epidemiology, biostatistics, social sciences, health policy, and healthcare delivery research. And we all come together to innovate and find the best way to implement novel interventions in populations.